Good evening. My name is Tanisha Kadiri, and I will be presenting on electronic medical records. The objectives of this presentation are to discuss the findings from the interview with the medical doctor and the registered nurse from Genesis Healthcare System, a long-term care setting. Also, to identify basic components of the system they are currently using, discuss the strengths and weaknesses of the system, and to summarize the interviewee's responses. Okay. As the healthcare industry becomes more integrated with networks of providers and payers, there is an increasing demand to rely on shared documents, shared data. So, electronic medical records really do help with reducing instances of medication errors. They help with improving communication between healthcare providers, pharmacists, and prescribers. Yes, and ultimately, the use of electronic medical records optimize safety um, for the clinicians to engage in. The system that I will be speaking of would be the point click care system, and this system is geared for long term care settings. It is one of the one of the market leading providers for the long term care setting. And Point Click Care offers a regulatory interoperable electronic medical record system that helps deliver management with finances, marketing, business, patient care. And it has also received the KLAS Software Vending Award. And the class actually is a healthcare system that performs at the top of their market. They acknowledges them, and this is their setup feedback to become a vendor and how to be in a prestigious acknowledgement of using software. So this is the feedback that they give. The class works with the vendors. The healthcare professional shares their experience. The class actually goes into how the software is in compliance and does quality checks. The team members does the research data to identify trends and insight. And they also shares the research of the findings data within professional healthcare organizations. So class conducts a random survey of long-term care providers, and point-click care was identified as one of the fundamental needs to ease of use. The system point-click care actually helps the provider meet the challenges for providing long-term care for seniors. It helps them with enriching the lives of the residents, improving financial and operational health, and mitigating the risk. Point Click Cares also is being used by over 11,000 senior care providers. So the software is extremely in demand in the long-term care settings. I was able to capture some images of what the software looks like for the perspective of the medical doctor and for the registered nurse. And on this screen here is actually the home screen. You can see the home dashboards reporting standards, operation, marketing, and admissions. And the healthcare provider would just click on the tab and fill out the documents within there. You have a clinical, under the clinical tab, you'll be able to select if you're the doctor, the pharmacist, the social worker, the administrator, the director of nursing, and then the term used for the facility. And here is giving you the option to pick admission or discharge, the RIM number. And it is privacy driven because you can search for the resident by their last name, their first name, or their room number, not a first and last name basis. The next slide is also an image of point click care. And this point click care image is just basically showing how the nurse would begin an admission. And as the nurse is using this system, she's doing the overall admission, and she's able to leave it open for the MD to come through to review her findings or his findings. And also social work can review the findings just as well, and other disciplines within the facility. The medical director also comes on and reviews it and signs off if a patient has been admitted into the facility, and uses the same mechanism. The data will be saved, and this is how they are using technology to share information amongst each other in the healthcare setting. Okay. Okay, so when I spoke with the doctor, actually entering the doctor, was a very informative interview, because the doctor had a nice experience in reference to using the system. The doctor has been practicing adult medicine for over 30 years and transitioning into the regulations of having computerized data was new to them, and they are adjusting fairly well. Now, the present concepts that were identified from the doctor were the ability to have health data exchange, to communicate through care networks, to have quick and updated patient data, and safely protect and transfer medical and finances records. The organization in which they work for, which is Genesis, monitors its patient database for patient identification errors, and patients are registered by using a centralized common database using standardized procedures. So the doctor is pleased with that present concept. And also the present concept of the RN is the ability to have a holistic view of the patient, to be able to go in and get all the data that is needed to provide initial care for the patient, gain real-time information exchange and more accurate documentation, the ability to have access to lab results for immediate review. However, there are some concepts that were missing, and the doctor actually highlighted that the missing concept that they would like the ability to do is write orders to correspond with the pharmacy without having to use a different system. Also, to have access using the personal computers. At this time, only the computers that are inside of the facilities are able to access point-click care, and then also be able to send referrals out to other providers outside of the network, some kind of linkage to let the other healthcare providers, which are in the hospital versus in a long-term care center, get their referrals. The missing concept from the nurse's point of view was the inability to review the patient's orders, because there's no orders in this system. You have to use another system for pharmacy and medications. To correspond with pharmacy again, the inability to track wound care, because a lot of patients that are in a long-term care setting do develop wounds, and the ability to track them as they are admitted and throughout their stay would be a plus. And the inability to upload and track patient information from other networks, a patient transferring in from another clinical setting. Okay. Now, the limitations for both the medical doctor and the RN are the same. It's a newly system that's been embedded inside of the point-click care feature, which would be called Emrqt. And that Emrqt stands for Interventions to Reduce Acute Care Transfers. Now, at this time, the point-click care does not have it in the system, but they are looking to invest the finances into the Emrqt, because it's a quality improvement review of hospital transfers. It offers the industry only to have electronic medical records platform that integrates the tools of clinical workflow. The point click care will help the long term care organization demonstrate to the local hospitals and accountable care organizations that they can prevent costly and unnecessary patient readmissions. So again, the limit system value were identical from the medical doctor and the RN perspective. They would both like to have the Interact incorporated into their system. Now, there are strengths within using the point click care. The doctor identified the strengths as the ordering clinician is identifiable. They can understand who is seeing the patient. Also, the orders and tests and reports are available, and they're able to have access to the software to provide follow-up information. And again, the doctor has over 30 years of experience and is noting that the staff appears much happier. The data indicates improved performance, better patient outcomes, and it's designed to connect care with interdisciplinary teams. The strength of using the system from the RN position is embedded decision support tools. The documentation is more consistent and complete, and the ability to have prompt notification of important changes in the resident's condition. Urgent clinical information is delivered in a timely manner, and delivery is recorded in a electronic medical record. And things are time sensitive and time critical. So this is very, very, very important to the nurse. And these updates give healthcare team ample time to react before change escalates into an acute situation. Now, within the system, there are some weaknesses that were highlighted, and the doctor has stated that relying on technology in regard to health-related information is kind of tricky because it does not basically give all of the needs that are met for the patient in one setting. So the system is not designed to identify trends of quality improvement, and the doctor would like to have that incorporated. The weakness that was noted by the nurse, was the interface problems, professional service from the IT support team. When a system fails, the wait time and response for repair delays the time frame to provide care for the patient. And then also having the communication strategy when infrastructure has downtime and recovery periods are needed. Analyzing the information from this interview was very helpful. It provided an effective decision-making structure from the point-click care system that exists for managing and optimizing the safety and safe use of the electronic health records. The interviews provided a very informative insight into using electronic medical records for finances, care delivery, business intelligence, and compliance. When I am comparing and contrasting the perception from the doctor and from the nurse, it is the perspective is very similar. They both are enjoying the real-time decision-making procedure with using point-click care as their system of choice, and really do not have any objections to using electronic medical records. The lesson that I learned within this experience was bringing awareness to the excess of medical information. I was not aware that there's only systems used specifically for long-term care, and also preparing the next generation of clinicians to be ready to lead to better interpretations for health informatics skills. My conclusion of the interview is that point-click care provides protected patient data and it is upholding the standard of law. Point Click Care is designed to perform across the senior care continuum. All of the features needed by healthcare providers can be received using one platform. And at this time, Point Click Care is highly recommended. Thank you for your time.